Hi, I'm Jennifer Granholm, and this past week, as you know, on the federal level, they passed healthcare reform. And so we've been getting a lot of email and letters in the office about what this means for people. Let me just share a few of those letters with you, and then I'd love to chat with you for just a moment about what this means for our citizens in Michigan. So for example, I have an email here from Harrison Township, and it is a woman, and she says the following: I've suffered so much under the present healthcare system as an unemployed business professional of Michigan with a pre-existing condition. I went from welcome to the doctor's office to get care to we can't treat you completely unless you pay before you get in. Another one says, and this is from a woman in Wyoming, she says, I am a stage 4 ovarian cancer survivor who's constantly worried the cancer will return and that I'll be dropped from my insurance provider. A man from East Lansing says, as a family doctor, I've been seeing patients daily who are struggling with the personal effects of our state and nation's economic struggles. They worry about the potential loss of health insurance, the downgrading of health insurance options by companies, and how that affects their families. And they're also worried about what would happen if they become seriously ill. I spend more time counseling about how to seek less expensive meds, completing forms to assist with this, and looking up information from patients on how to find what they need. The healthcare legislation, while not perfect, offers interventions that can substantively help these individuals and offers hope of options for them in the future. And then the final one I have here is a woman from Rockford, and she writes, but even if some people don't want health insurance, they need it so they don't become a burden on the system should they become seriously injured or ill. So that's just a bit of a snapshot of what people are experiencing or are concerned about. And let me just give you a quick snapshot of what this is going to mean for Michigan, and both this year as well as into the future. As many of you know, some of the changes start to take effect in 2010, but some of them don't take effect fully until 2014. This year, the impacts will be felt, for example, by young people, like perhaps those who are watching this. If you're between the ages of 18 and 26, and there are 950,000 of you in Michigan, you will be able to stay on your parents' health insurance starting this year, which is great news. For senior citizens, those who have reached the extent of their prescription drug payments under Medicaid, they will be benefited this year. They'll get a $250 check. There's about 275,000 seniors who will be benefited. And seniors, by the way, won't have to pay for wellness visits, for visiting their primary care physician to get a checkup. They won't have to do co-pays for prevention treatments. That's very good news for them. For children who have pre-existing conditions, starting this year, they will not be allowed to be kicked off of their health care, and insurance providers won't be able to deny coverage based on a pre-existing condition for a child. And then adults, it will happen later on into the reform years as we go forward. I think it starts next year that adults won't be able to be kicked off if they have a pre-existing condition. That's about 140,000 people will be benefited for that. In fact, this health reform does a huge amount for readjusting how we view healthcare. Up till now, health insurance providers, those who are doctors, those who are hospitals, they have been paid for every particular procedure that they order. So the more procedures that they ordered, the more money they made. And so, in other words, healthcare providers were rewarded for the number of inputs that they put into the system rather than the outcomes, and the outcomes being a healthy person. This changes that entirely. Now, healthcare providers will be rewarded if their patient is healthy. And in fact, this whole thing takes the decisions out of the hands of insurance companies and puts it into people. If you like your healthcare provider, if you like your insurance, you get to keep it. If you don't have insurance, you might be one of the people who is able to get subsidized insurance through this healthcare reform. In fact, there'll be about 375,000 people in Michigan who now will be covered under Medicaid as a result of this health care reform. That will phase in and be completely phased in by 2014. If you're a small business, you'll get a 35% tax credit for providing health care to your workers. If you have 25 or fewer workers and you pay 50% of that, you'll get a 35% tax credit. There's so many good provisions, and yesterday I signed an executive order that creates an oversight council, essentially, that helps us to implement on the state level what is happening, of course, across the nation. We will have a website at michigan.gov/health reform, and that website will be able to answer your frequently asked questions. But the bottom line for Michigan is that this is a great benefit to our citizens, reducing the cost of health care, improving the quality of health care, and improving access to health care. Honestly, I'm so excited as governor of Michigan that this is happening. Even though it's in my last year, it certainly will be happening for all of Michigan well into the future. It's a revolutionary change for the nation. It's a very good piece of news for Michigan. So thanks for listening.